Welcome to the last Quality Leader webinar for 2025. I'm so glad that you have joined us, and wanted to just remind everyone that this will be recorded and will be available in YouTube under Constellation Quality Health. So if you want someone else to view it, please encourage them to do so. My name is Peggy Peterson. I'm a quality improvement specialist with Constellation Quality Health, and I have the pleasure of introducing Patrick. And Patrick is going to be talking to us about cybersecurity considerations and with long-term care considerations. And I'm going to introduce Patrick and tell you a little bit about him. And Patrick serves as a quality improvement advisor for emergency preparedness with Constellation Quality Health. Prior to serving with Constellation, he served for 9 years as the regional director of the U.S. Cybersecurity and Infrastructure Security Agency and 20 years with the Federal Emergency Management Agency. He has assisted healthcare facilities with cybersecurity assessments and in disaster planning. He has held several professional certifications, including Certified Information Security Manager and Certified in Risk and Information Systems Control. With that, I'd like to introduce Patrick, and thank you, Patrick, we look forward to your information.
All right, great. Thanks, Peggy, and hello, everyone. Thank you so much for your time. We're gathered here today to talk about cybersecurity, everyone's favorite topic, I'm sure. So cybersecurity considerations, cybersecurity controls, we're going to dig into it all. Just have about 24 slides. We'll take about 45 minutes in the presentation. If you have any questions, if you want to put it in the chat, that would be great. And then at the end, we'll have a little Q&A time. We'll dig into the questions and any other questions that may pop up. So let's dig in, and next slide, please. Just a quick little primer, Constellation Quality Health. I think everyone knows who we are. We're a nonprofit healthcare quality organization. Our team of experts provides services that focus on quality improvement and clinical reviews and audits that are designed to improve care delivery, system performance, and patient outcomes. So that's us. And next slide. I think you got a little intro. That is me when I was a younger man. Next slide, please. All right, so let's commence. Cybersecurity. So a few weeks ago, when I was asked to give this presentation, I thought, all right, cybersecurity, gosh, where do we start? There's so much going on in cybersecurity. It's something akin to someone reaching out to you and say, hey, I want a presentation on nursing homes. Well, gosh, there's a lot to it. There's a lot of moving pieces. So I thought about, well, what's the best information, add the most value? I thought about talking about cyber threats. Pantheon of threats, there's numerous ones like business email compromise and man-in-the-middle attacks, ransomware. Thought about talking about cyber threat groups. We can have a great conversation about that, about hacktivists, about cyber criminal gangs, about nation-state adversary APTs, advanced persistent threats. So for instance, we know that APT 28, which is, the GRU, Russian military intelligence, better known as Fancy Bear, and APT 29, all these terms, that's Russian intelligence, Cozy Bear, that they target pharmaceutical companies and clinical researchers. We know that Russian cyber criminal gangs, if you're in the cybersecurity space, you hear about a lot of these cyber criminal gangs out of Russia targeting healthcare, criminal gangs like Conti, Royale, Black Basta, Reville, Killnet. Enter into cyberspace, you would know all about these gangs. And that's just Russia. We have China, which is even a greater threat, criminal gangs in the nation state, North Korea, Iran. And I thought, okay, well, maybe cyber vulnerabilities. We can talk about that. Unpatched legacy systems, network misconfigurations, Internet of Things devices. And I thought, all right, well, maybe cybersecurity program development. That is really important, right? Hey, every institution, organization needs to have a cybersecurity program. We can talk about setting your objectives, whether it's privacy protection or cloud security, how to develop a policy for each, how to conduct a risk assessment on each of those, and then come up with a program with controls and metrics. Then I thought, what would be cool would be AI, artificial intelligence. There's so much going on in the AI space, all sorts of threats. Could talk about how AI is impacting cybersecurity, both in the defense, things like behavior analytics, or in the offense, how it's supercharging hyper-realistic phishing emails. Third-party risk management, software supply chain attacks that even if you're doing everything right, your organization, if your vendor falls down, that's going to impact you. So anyway, there's that laundry list there on the slide, but I decided to talk about that last thing, highlighted in yellow in the bottom right-hand corner, to talk about controls, cybersecurity controls. And controls are simply cybersecurity measures taken to reduce risk, to ensure your healthcare organization's objectives, your business objectives, can be met. So that's what we're going to focus on. The lion's share of the presentation are controls. And the intent is not to make you an expert in these technical controls and other controls, but it's simply to arm you with the right questions to ask so you can reach out to your IT and IT security staff and say, hey, do we have these controls in place? Okay, next slide, please. So our agenda is threefold. We're going to start at a very high level, talking about cyber risk, just a big overview of cyber risk to the healthcare sector. And then we're going to delve into some core cybersecurity concepts to set the foundation. There's a handful of things that are very core to cybersecurity that if you kind of understand these basic tenets, you're 70% of the way there to understanding cybersecurity, or at least asking the right questions. And then finally, as I said, we're going to delve into controls. And again, the purpose is just to arm you with info so you can ask the right questions. Next slide. Okay, cyber risks. We're going to talk about risk to healthcare organizations. We'll talk a little bit about ransomware. That's kind of one of the threats du jour, especially the last 3-4 years, that's really impacted healthcare organizations. And then talk a little bit about HIPAA. What are the requirements when it comes to information security? Next slide, please. Okay, so cyber risk. When it comes to cyber risks, they really come in 3 different flavors. So the first is IT, information technology. So this is what most everyone thinks of when they think of computer networks and software, right? So IT handles digital information, all of your business operations, data like electronic health records, imaging, health information systems. And the risk includes some of the things you know about, right? Ransomware and other malicious software, phishing scams, steal credentials, data breaches, and the exfiltration of protected health information. So when it comes to IT, I think these are things that you need to think about as a provider is, can you continue patient care without access to your electronic health records if you suffer a cyber attack or the internet goes down? The second category is what's called OT. This is operational technology. Not a lot of people know much about this or are maybe even aware it even exists, but it is just as important, ostensibly maybe even more important than information technology. So OT, operational technology, is software that runs, controls, and monitors physical processes and systems. So nowadays, virtually everything runs off software via the internet. whether that's critical infrastructure, massive systems, electricity and water, down to things like your HVAC systems and oxygen supply, your refrigeration system. It all runs on the internet and software. It's often referred to as ICS, industrial control systems. So as you can imagine, cyber attacks to operational technology software can cause severe life safety risks, improper dosing of chemicals or the loss of power. So again, as an operator, you got to think on these systems, can you operate these systems manually? And then finally, the last in the troika is IT-OT convergence. And this occurs when IT systems like data are connected with devices that control physical processes and other physical devices. So medical devices are just a great example of this. Pacemakers, infusion pumps, robotic surgery. Many of these require firmware updates and wireless monitoring. But again, manually, can you calculate drip rates manually if there's a cyber attack and IT and OT conversions? Okay, next slide. Let's just talk briefly about a few examples of cyber risk to medical devices due to this IT and OT convergence. So, things like pacemaker is one example. It's an Internet of Things device, right? So many of these Internet of Things devices oftentimes do not support data encryption. There is no data encryption. And passwords, if they even have a password, most don't, are often in plain text. Many also use, Bluetooth devices that also lack data encryption. So they're wide open for an attacker. And then for each of these medical devices, and there's many, many, many more examples, you can read all the interconnectivity here, IT, OT. But many medical devices are run on what's called things like legacy software or legacy software, boutique type software that's probably unsupported in many cases and unpatched, meaning it was developed by a special use 15 years ago by a company, and that company may not, it may not be in business anymore. So there's no patches, there's no updates. So a lot of these medical devices, again, are very vulnerable to attack. Many of these devices may not be segmented. We'll talk later on in controls about network segmentation, how important that is. But if you gain entry to these devices, because they're not segmented, it's often easy to move laterally to gain access into your network by an attacker and pivot to other devices or other parts of your network. And then, not to be Debbie Downer here and drill on, and then there's 5G wireless. So that is being deployed now at scale, finally. And, all these wave small cells that are on phone poles and on buildings. And it's great. There's low latency, high bandwidth. But that super connectivity also increases the potential attack surface in healthcare facilities. So there's simply way more entry points for attackers. That high bandwidth of 5G can enable more powerful DDoS attacks, distributed denial of attacks, man-in-the-middle attacks because data is not encrypted, making data interception easier for hackers. So I'm just trying to paint a picture that a lot of this profusion of technology, IT, OT, IT convergence, data on your network, medical devices is at risk. Okay, next slide, please. So here's the hope. The hope is one day you don't turn on your computer and find this message on it. Hey, your data has been encrypted, fork over $1 million in Bitcoin to get your data back. So it's a screenshot from a ransomware attack. What's happening right now is anyone can buy ransomware tools on the dark web. You see this rise of what's called ransomware as a service. Has significantly contributed to the increased frequency of ransomware attacks in the healthcare sector. I mentioned that Conti gang, cyber gang out of Russia. they're infamous for ransomware as a service. They came up with the model and they made a ton of money on it. So the ransomware as a service platforms have really democratized access to sophisticated ransomware tools, allowing even those folks with minimal technical skills to launch highly effective attacks. This model greatly lowers the barrier to entry for attackers, making ransomware attacks much more accessible and efficient. And the beauty of these platforms, if you can call it that, it's one-stop shopping. You can go on the dark web and ransomware, and you can get a comprehensive suite of tools, including encryption software, payment processing for Bitcoin. There's even customer service for negotiating ransom payments. It's a white glove service, which enables more and more cyber criminals to execute ransomware campaigns. And that's really what's increased that's increased the uptick of ransomware attacks in the last few years. Okay, next slide, please. So I just real quick, not to drone on about ransomware, but this is a little bit dated data, end of 2023, but you can see healthcare, number of ransomware attacks on healthcare organizations. And remember, these are only ones that had been reported to the FBI, and only a tiny, tiny fraction of ransomware attacks, 2%, I don't know what it is, but it's not many, actually get reported. A lot of times, in-house legal counsel, cyber insurance don't report it. They don't want to get out to shareholders. We'll pay the ransom. We'll do whatever. So an example of how this works, so attackers will use something like a phishing email to access a hospital network, and then try to exploit an unpatched vulnerability to then deploy the ransomware. They can encrypt electronic health records and patient care systems, and then demand a ransom in Bitcoin to get the decryption keys to get your data back. And then, in what's called a double extortion tactic, they then also exfiltrate that sensitive patient and financial data and upload it to the dark web. And then they send an email to the patients, thousands of patients or whatever, threatening to leak that data or keep it on the dark web and not remove it unless you pay more money, a ransom at the individual level. Give us $100 and we'll remove the money from the dark. We'll remove this information from the dark web. That happens. There's been attackers have exploited vulnerabilities in nursing homes, unpatched legacy software, again, moving laterally to compromise patient scheduling and medical records. Again, the attacker will encrypt the data and demand payment. And again, using a double extortion tactic, they'll also exfiltrate that patient medical records and then send an email to all your vendors and patients also asking for payment. This isn't sci-fi. This has happened quite frequently. Okay, painting a real happy picture. Let's go on next slide, please. I want to talk a little bit about HIPAA. I thought, kind of messing around the internet, I found this. I wasn't aware of this. It was interesting, but so to back up. So as you know, under HIPAA, you're required that all protected health information has to be safeguarded, right? So examples of PHIs, it's called, include a patient's medical records, doctor's notes, prescription list, hospital bills, insurance claim forms, all of that. What's interesting is Department of Health and Human Services lists all of these HIPAA reported data breaches that are reported on a website. There's the link. You can go check it out. And there's a couple of hundred or more in 2025. And remember, the HIPAA rule only requires healthcare organizations to report PHI data breaches for any unsecured or unencrypted data. The theory being if an attacker exfiltrates encrypted data, well, they're not going to be able to view it because it's encrypted. So this is just unencrypted data that's been exfiltrated. So, of course, the question is, do you, in your organization, do you know in your network where your PHI is located. How is it protected? And are controls working properly? Okay, next slide, please. Okay, so we're just going to talk at a high level about some basic cybersecurity concepts. These are some important terms and concepts because they underpin really all cybersecurity activities. Next slide. So the first of these is the CIA triad. It's not the CIA that you may think of. It's not a big secret, but when cyber defenders talk, they talk about the CIA triad. So everything we do is based on protecting information, the confidentiality, the integrity, or the availability of data. So every control we're going to talk about in a few slides is meant to solve a gap in one of those three in the triad. So confidentiality is about maintaining the secrecy and privacy of data. So an attacker cannot gain access to data, can't view it, and they certainly can't exfiltrate or steal it. An example, of course, is protected health information. And controls for this include things like encryption and access controls, the concept of least privilege that you need to know for your network, who can gain access, multi-factor authentication, you've all heard about that, strong passwords. The next is integrity, and that's guarding against the improper modification of data. So an example, if a dosage of medication was altered or given to the wrong person, right, the impact could be quite bad. What you see as an example, like with the rise of AI, what many firms are concerned about, the federal government, is, as one example of integrity, is something called data poisoning, where malicious actors, are trying to gain access to these large language models and then enter bad data into the training set to manipulate the responses that the LLM will give, right? That's an example of integrity. Controls include things like hashing and digital signatures, again, encryption, data at rest and in transit, and a few other things. And then finally, availability, right? And that's providing consistent access to data. So if you have a managed service provider, which many of you probably do, that does all your IT network infrastructure, you have probably a service level agreement or some KPIs with them. It should state the required level of availability. Is it 95%? Is it 99.997%? Controls include having backup systems, doing things like load balancing to distribute network traffic amongst numerous servers, having an incident response plan, and that sort of thing. Okay, next slide, please. All right, I know this is a lot to absorb, but a couple more here on basic concepts. So another very basic concept underpinning cybersecurity is defense in depth. So adopting a defense in depth strategy is really critical in creating a layered security posture that can effectively thwart cyber attacks. So this strategy involves securing every layer of the healthcare infrastructure, from the network to the endpoints to the cloud. In other words, you want to have levels of protection by implementing a broad range of controls that are operating at each of the levels of your network. The more layers of protection you have, the harder it is on the attacker. Something to keep in mind, it's like regular criminals, is that when it comes to cyber criminals, they're really lazy, which means if you have good layered controls, at some point an attacker, they're going to try a little bit. If they can't break in, they're going to give up and they're going to move on to another victim that isn't your organization. So that defense in depth, controls at various layers of the network is critical. All right, next slide. And there's a lot to be talked about the cyber kill chain. And this is, there's a method to the madness for a cyber attacker. What I'm showing here is what's called, it's very frequent in the business, called the MITRE attack framework. MITRE is a corporation. Attack stands for adversarial tactics, techniques, and common knowledge. It's a framework or steps in how cyber adversaries attack a network. And again, there's steps. It starts, with like a pre-attack phase, or a discovery or a reconnaissance phase. So before moving, cyber criminal actors are using discovery techniques to understand your network. So this includes gathering info on network topology, searching for accounts they can use, or scanning your network for open ports. It could be just open source research. They want to know the org chart of your organization, get emails of your leadership, anything, right, to do that reconnaissance. Then you go into phase 2, the attack phase commences with weaponization. That is creating a malicious payload. A lot of examples. Then, of course, you want to deliver the payload, the infection phase. That can be via phishing emails, text and social media, visiting a compromised website, or exploiting security flaws in a system or application. And then once they do that, then they can commence the exploitation phase. This is what it's all about. Credential harvesting, credential access. Actors often steal legitimate credentials through methods like keyloggers and credential dumping, or exploit a network misconfiguration to gain access to user accounts and administrator privileges. And then they move on to the next phase. I mentioned before, that's lateral movement. So now they're in, and now once they have credentials or discover a vulnerability, they move laterally between networks or systems using network protocols like remote desktops. There's a new flavor of movement out there called a living off the land technique. This was something that China really pioneered, called one of the cyber campaigns, going on a rat hole a bit, but it's interesting, called Volt Typhoon, which is a living off the land technique, which means, the attackers use, things like built-in operating systems, like, Windows management instrumentation or PowerShell, right? Since these are legitimate tools, there's no signature and there's no malware. So that living off the land technique can be really difficult to detect. And then finally, exfiltration, right? Once they're inside, they move laterally where they want to go. Then they can do whatever they want. They want to establish a command and control channel, to manage the compromise, to enable the attack. And then they can exfiltrate protected health information or do whatever you want. This MITRE attack framework is really important for the people in the cyber business. I know in the wall in our office, we used to have a big poster, and this attack framework has like 14 attacker steps, like 14 columns. And underneath those are like scores, dozens of techniques and tactics that an attacker uses. So I mentioned like those advanced persistent threats, like a nation state adversary. How do they know, hey, this is APT10, right? This is China, or APT1. Well, they know because those APT attackers do have their own little signature. They're using these tactics, like in the MITRE attack framework, again and again. They're really good at it. And so as you watch them, you can understand, okay, well, this has all the hallmarks of APT10. All right, probably more information than you wanted to know. All right, next slide, please. So the last foundational component of cybersecurity are cybersecurity frameworks and standards. So every organization should adopt a framework or standard to organize their cybersecurity program. So these frameworks provide a structured approach for organizations to identify, assess, monitor, and mitigate threats to their systems, to help establish a strong security posture. And And they provide a common language for leadership and IT security pros to communicate about security risks. And moreover, they really help organizations meet regulatory and industry-specific compliance requirements, such as HIPAA for healthcare. So there are several frameworks and standards you can see there in the right. Shown here is what's called the NIST Cybersecurity Framework, National Institute of Standards Cybersecurity Framework. So that groups cybersecurity into 5 functions, and each function is comprised of several categories. Under each set category are several controls. There are also several standards that ISO 27001, Information Security Management System, is probably the most popular. That lists 93 cybersecurity controls. That NIST 800-53 has over 1,000 cybersecurity controls grouped into 20 families. And then things like SOC 2 that are mostly germane to the finance industry, that PCI DSS applies to credit cards if there's a standard. So the interesting note about HIPAA, so the HIPAA does not require the adoption of a specific cybersecurity standard. But of course, it does require healthcare organizations to adopt safeguards to protect electronic PHI. Even though HIPAA doesn't require it, I highly recommend that your organization adopt a cybersecurity framework. So maybe one takeaway, you can go back, ask your IT folks, your IT security and managed security provider, hey, what cybersecurity framework or standard are we using? And if they say they don't know, or we don't have one, that is not a good sign. Next slide. I think everyone is aware that under HIPAA breach notification rule, again, you've got to protect protected health information. So the guide on that, an army of letters, is the NIST 800.62 document, the HIPAA Security Resource Guide. What you're going to find for the HIPAA is that it's more of a guide. There's a handful of standards in there that are required, but the HIPAA security standards are, with exception of a few requirements, are mostly a guide. They give a lot of latitude, which is good or bad, depending on your perspective. But again, that's why I go back. I really recommend adopting that NIST cybersecurity framework for your organization. Then you'll be covered not only to meet HIPAA requirements, but to do a lot more. All right, next slide, please. Okay, now we're going to get into the meat here, cybersecurity controls. We spoke a bit about risks and threats and vulnerabilities, but what should you do to protect your organization from these cyber threats and cyber vulnerabilities? Next slide. So controls. Please know first, there are several synonyms for controls. Controls is a state of art and the term of art in the cybersecurity community. But you can call them a risk reduction action, a risk mitigation action, risk treatment, risk response action. They all mean the same thing. It's all a synonym for a control. 3 types of controls. Again, this is kind of a core tenet. Administrative controls, things like adopting a cybersecurity policy for your organization, documenting the network topology, those sort of things. There's physical controls, right? Video surveillance or locking doors so they can't gain access to your server closet. And then technical or logical controls. SIA controls there, multi-factor authentication, encryption, strong passwords, audit logs, and so forth. Next slide. So just a couple of considerations. This is a little bit of a detour before we get into the controls proper. But let's talk about cloud computing. So last 15 years, the age of on-premise IT infrastructure has gone the way of the dodo bird. Almost everything now is done in the cloud. and there's services like infrastructure as a service, platform as a software as a service, very common. So what's important to know is what's called the shared security model. So if you have a software as a service from a cloud security provider, then in that case, most of your cybersecurity is handled by the cloud security provider, the cloud provider, Amazon, Microsoft, whatever. However, infrastructure as a service, which is basically IT infrastructure networking on demand via the internet, all the networking and virtual services. With infrastructure as a service, you, the organization, are responsible for most cybersecurity measures, not the cloud provider. That's a very, very important distinction. And this is where organizations fall down. Well, we've got Amazon Web Service. We don't got to worry about cybersecurity. That is not true. For software deployments, that's true. But if they're managing your infrastructure, 80% of the cybersecurity tasks, application security, identity and access management, data encryption, on and on, that's your responsibility as an organization. So the foot stomp there when someone says, well, we don't got to worry about it, we've got the cloud, that is not true. It's the onus is on you to provide security. The other thing is the rise of managed security providers. Last 5-10 years, having a large IT staff in your organization, that's going away, the dodo bird. A lot of people contract out their network management to manage security providers. So it's very important to know, what your managed security, what your managed service provider is up to, and what cybersecurity services they're providing. Then my last point, again, a detour from controls, is about cyber insurance. So about 70% of healthcare organizations do not carry cyber insurance. You have a whole presentation on this, but one benefit of having cyber insurance is that usually comes with a cyber incident response team that works for that insurer. So if you're a victim of a big cyber attack, you call your insurer, they can deploy a team, right, to help you identify, contain, and eradicate the threat. If you don't have cyber insurance, I would try to have a cyber incident response firm on retainer. So if something goes wrong, you can call them. Of course, if the response time is an hour, you're going to pay more than 24 hours. Because if you don't have that, in the heat of the moment, you're a ransomware victim or whatever happened, and now you got to go through the yellow pages and try to find a cyber firm and negotiate contracts, and you're going to be spending a lot of time doing that and wasting a lot of money. Okay, next slide. So let's get into controls. This is kind of what we're here to learn about. That was a lot of lead in to this one slide. The top 10 cybersecurity controls. First, as a disclaimer, this is just my opinion. This isn't like a physics equation. These are the top 10. It's just what I think are the ones that will give you the most bang for the buck, that have that layered security model where it covers controls on different aspects of your network at various points. And again, provide just the most protection for, relatively cost effective. Melissa, if you can go maybe advance one more slide. So there's a whole other series of other controls. So some other people might say, well, Pat, number 11, cybersecurity policy, that should be in your top 10, right? It's really important to have that organizational policy, get the C-suite to buy in. Hey, cybersecurity is important. Here's the persons that are responsible. Here's what we're going to do. And that's a fair argument that could be in the top 10. And like I said, here's all these other controls, and there's many dozens and dozens more. But anyway, I just wanted, there are other controls, but all right, we can go back one slide to the top 10. But anyway, these are the top 10. So my opinion, and again, these are the things that I would poke your IT or IT security staff or your managed service provider. Do we implement these controls? And then, see what they have to say. So the first one, asset inventory. So you can't protect what you don't know. So new devices, portable, mobile, network, including Internet of Things devices, cloud service, software, third-party applications are constantly connecting to your network daily. So do you employ an asset discovery tool to identify and map digital assets? Again, you can't protect it if you don't know it exists on your network. And having devices out there you don't know about is a huge security risk. And that's what the attackers will find out to gain access. Patch management, we all know about patches. That's basically deploying software patches to fix bugs, problems in the software. This is especially important for operational technology. Operational technology values availability, the big A, right? You got to keep that HVAC system operating. You can't shut it down for 20 minutes when you're doing an update, a patch. So the question to ask is, do you use any tools, your IT folks, that automates the process of detecting and deploying software updates? Having that regular patches is vitally important. Number 3, network segregation. That is when you divide your network, a large flat network, into multiple zones using firewalls and intrusion detection, intrusion prevention systems that I'll talk about in a second. That is really important because, as I mentioned before, what the attacker wants to do is gain access to your network, but they want access to the whole bloody thing. They don't want a narrow portion. Hey, here's your business operations. They want everything. And we used to find time and again in these cyber attacks. I know we used to work at county governments a lot, but there's a corollary to healthcare organizations. At the county, an attacker would get in via an Internet of Things clock hanging in the wall of their emergency operations center. But then, because they had a flat network, they were able to move laterally, get into the planning department, get into the county building department, get into their elections, administration department, on and on and on, and take out the whole bloody network. And that is not a good thing. So network segmentation, again, having firewalls and intrusion prevention systems. So even if an attacker gets in here, they're not able to move laterally across your organization and take out a bunch of other things, exfiltrate data or take you down. Number 4, intrusion prevention system. This monitors and blocks malicious software traffic. So an IPS is going to examine the content of each packet, looking for malicious signatures. It's a little bit different than a firewall, where a firewall blocks activity based strictly on the IP or the port. So having an IPS or multiple IPS, especially things that are externally facing, that is wickedly important. Number 5, endpoint detection and response. So endpoint detection and response is very similar to an intrusion prevention system, but it's on each device, right? So each laptop computer, each iPhone, router you have, it could be a medical device, medical equipment, whatever. But each endpoint has an EDR solution on it that analyzes network traffic to identify threats. This can get a little pricey. A subscription, runs, roughly it varies by vendor, but about $60 per endpoint. But if you Google now endpoint detection response, you'll see a whole bunch of vendors, CrowdStrike, Falcon, and not that I advocate anything, but there's just a laundry list of vendors that do that. Again, maybe at $60 an endpoint, you got 1,000 endpoints in your organization. That could add up every year, 60 grand a year. If you ask me, it's worth the investment. It's a great solution that, it saved the day for a lot of organization having that EDR solution. All right, so I'll drone on. Number 6, multi-factor authentication. I think everyone knows about this, right? Users provide 2 or more verification factors in order to gain access to their accounts. Again, it's just an added critical layer of security. If you don't have MFA, please just start somewhere. If it's your email account, somewhere to adopt MFA, again, a password, and then something else, something you know or have. Again, that makes it that much more difficult on attackers. Number 7, vulnerability scans. You want to conduct a vendor. There are some institutions like CISA has a free vulnerability scanning, but it looks for vulnerabilities on your network. Connect to STAN, look for outdated software, open ports, deprecated protocols, misconfigurations, malicious services running your network, and they'll give you they're not going to stop bad things from happening, but they'll let you know, hey, you've got this problem on your network. So do you have a routine scanning services? Number 7, staff training. 80% of the problems are cybersecurity, our own people clicking on malicious links. I know when I was with the government, we had this phishing campaign assessment we did for organizations, right? We send these fake, emails out or whatever to see if people will click on the link. And yeah, about 10% of the phishing emails that were sent to people, people clicked on them. So, that's 10% too many. And of those that received them, only about 14% actually reported that malicious link to their IT folks. So again, people are the problem. I mean that in a very kind way. Number 9, having a cyber incident response plan. My experience is about a third of organizations have a good cyber incident response plan. A third have something in writing, but it's not very good. And a third have nothing. So you definitely want to put together a cyber incident response plan. And then finally, secure backups. You want to maintain offline backups, right, to avoid ransomware encryption and everything else. If that's having a second cloud security provider or something on premises, that data backup. So, if you need to restore systems, maybe they've only lost 1 hour or 4 hours or 24 hours of data. The takeaway of all this is for your organization, do you use these controls? And are these controls included in your service level agreement or SOW with your managed service provider? Okay, next slide. Again, we talked about some of these other controls. I won't get into these for time, but there's many other controls, and all of these things on the screen are all good idea fairies. In a perfect world, you'd be doing all of these things too. Security, like anything, is a culture. It's not a control. And if you can create that security culture in your organization, you're going to be a step ahead of everyone else. And then last slide. All right. So here are just a handful of kind of resources that I think are great. That first one in particular is the healthcare cybersecurity performance goals. That lists a lot of the controls that I went over. So if you want a good list of controls that you should implement, ones that are easy, ones that are sort of mid-level, and ones that are really sophisticated, that is a great resource for you and your IT people to consult. That second is vulnerability scanning. Again, CISA actually has, Cybersecurity Agency has a free vulnerability scanning. You can sign up, it's free. They'll do a scan every week. It's loaded up with all the latest and greatest signatures from cyber threat intelligence private sector firms, the intelligence community. So it's helpful. And then a few other things in there. That last one, the Health ISAC, the Information Sharing and Analysis Center. I don't know if folks know a lot about that, but I would click that link. So that Health ISAC does a great job of putting together cyber threat updates and physical security updates for healthcare. They collect information again from the private sector and government, and they put it down in an easy to view way. So it's really good information. So I'd recommend signing up for the healthcare ISAC. And with that, next slide, please, Alyssa. We'll go to questions if anyone has any questions.
Hey, Patrick, there's one question in the chat, and the question is, has having a huge increase in remote work greatly increased the cybersecurity breaches that we currently see?
It does, or at least it had historically. It probably still has. Again, there's protocols like RDP, a remote desktop protocol. There's some risks there for adversaries to tap into that. A lot of it has to do with what I talked about endpoints and not knowing what's on your network. You find a lot of organizations, people do remote work, and they're using personal devices and other things, and they're downloading software because they're at home and they're not paying attention. And so that tends to kind of up the risk picture. It's a little bit harder for IT and IT security staff to control when folks are spread around the geography.
Okay, yeah, thank you. Yeah, we definitely see more, and I think people tend to download, apps without thinking too much about it. So, um, you know, but then also a lot of the healthcare facilities are under like one big umbrella. So I've seen it where, that majorly affects, the EHR, when it's been attacked.
Right.
People are down for sometimes a couple days. Does anyone else have anything to share or any questions that you have with, your experience with this or, questions on prevention?
I had a question. I was taking notes as you were talking, Pat. Thank you so much for the presentation. It was slightly terrifying. So I guess the big question I had was around the pacemakers. Just kind of thinking about that of patients that are coming into the facilities that they may be trying to log on to our guest internet servers that they may be accessing to keep their devices updated. Is there anything that we should be mindful of on that? I mean, the guest access is not really as maintained as our systems access.
Yeah, I mean it's certainly a risk because that guest Wi-Fi. I guess I'd have to know if it's encrypted or not. My guess is it is not. So that just increases the risk, right? That's probably not something you want to do. You would probably want to give them access to your password protected encrypted Wi-Fi in your organization.
It sounds like it's definitely something we need to talk to our cybersecurity insurance people on
Yeah,
do our assessments to say what the recommendations would be. I never would have thought about this. I was more concerned about how do you maintain not having 30 people watching movies at the same time.
right.
Didn't think about medical devices.
Yeah, that's a good question.
Wow. Thank you.
And does anyone else have any other questions or any comments? Thank you, Patrick. This was great.
All right, Peggy. All right. Well, thank you. Thank you, everyone, for sticking with me.
And there's the comment now, and this is great because I didn't think about that either. But think about pacemakers and IV pumps and that. But now the glucose monitors also download things automatically, and there's so many different products that are used. So that's another huge piece that could cause complications. So, all right. Well, thank you everybody for joining us. And at the end, there'll be a survey. And with the survey, if there's any topics that you would like to see done in 2026, we would love to hear about them. It will still be on the third Thursday of the month, and we will not have one in December. So the webinars go from January through November, the third Thursday of the month at 11. And we would love to have your topics. And in January, we're going to have a talk on performance improvement in healthcare. So that'll be excellent to hear about. And more of a focus too with QAPI. And then in February, we have our behavioral health subject matter expert that's going to speak to different behavioral health challenges in long-term care. So that'll be interesting. And he's going to talk a little bit about medication management as well. So with that, I don't have anything else. And again, it will be on YouTube if anyone is interested in seeing this in the future. Thank you, everybody. And thank you, Pat.